They came into my house. 5 of them. They raped me and my daughter in front of my husband. In the middle of it, he ran away. No one came to save us. My angel Sabine was...
Yeah, I just need a minute after that. Reading and seeing stories of African women, I found myself in a realm of reality that was beyond what my heart could comprehend. I'm sure you're all feeling the same way. Eastern Congo is the world's deadliest conflict globally since World War II. Widespread rape is used as a strategy of war and an instrument of communal terror, making this region the world's most dangerous place to be if you're a woman or a girl. Hundreds of thousands of women and girls have been raped. Sexual violence has been used to torture, humiliate, and destroy not only women and girls, but entire families and communities. Advocates from the region have told stories of unthinkable atrocities that are taking place, including sexual assault of minors as young as 20 months and elders as old as 87. You can't even comprehend it. And rape is not the only sexual health issue of importance globally. Reproductive health problems are the leading cause of health and death for women of childbearing age worldwide. Every minute, at least one woman dies from complications related to pregnancy or childbirth. That is over 500,000 women a year. Impoverished women, especially those living in developing countries, suffer disproportionately from maternal death and disability. Sexually transmitted infections, including HIV, unintended pregnancies, and other problems related to the reproductive system and sexual behavior. And the spread of HIV/AIDS is a continuing tragedy. Since the beginning of the global epidemic, almost 60 million people have been infected with HIV, and 25 million people have died of HIV-related causes. Through television's power to simultaneously educate and entertain, we hope that our work is making a difference in improving knowledge and concern and shining light on health issues and sexual violence in this country and around the globe. Thank you very much.
Mariska, thank you. How do you deal with the difficult subject matter of the show and run a foundation where you bear witness to such deep suffering?
I think that my answer was by doing something about it and refocusing. I think that, you hear these stories and it's, it's demobilizing? What's the word I want to say? Debilitating. And it's everywhere. It has to stop, and we have to educate. And I am so proud and honored to be on a show that does just that. And I think that is my answer, is by raising awareness and doing something about it and, giving hope back. I feel, to have this incredible machine behind me and an executive producer that is so courageous and will tackle anything and is educating everywhere is quite inspiring to me. And, the feedback that I get from people saying, your show changed my life, and the fact that these issues are on television, which means that they are indeed, water cooler conversation, that people are talking about sexual violence, they're talking about this stuff in ways that they haven't in the past because, and understandably, that people want to sweep it under the carpet. It is painful, it is difficult, it hurts, it's overwhelmingly scary, but the fact is, it's present. And we need to do something about it, we need to talk about it, we need to change the way we talk about it, and we need to be accountable for it. And it excites me to have a platform where we can do that and to open a dialogue about these issues. I didn't know about rape in the Congo. I didn't know. I was one of the people that didn't know. And so I'm so happy that I know, and I'm so happy that I can talk about it. And that's what we have to do, right? Talk about it.
Thank you. Thank you. We've seen some powerful footage this evening, and I want to show you an example of how compelling storytelling on daytime dramas can have a real impact. This will be lighter than the last clips you saw, but
These people are going to ask me to leave.
no, I don't think so. We're going to see a short clip from Tony's HIV. This is from The Bold and the Beautiful, one of the longest-running daytime soaps in the world. This was a minor storyline aired over several episodes about a young man, Tony, who learns he's HIV positive. He tells his girlfriend, Kristen, and they later get married and go to Africa to adopt a little boy. This story reached about 4.5 million households in the U.S. and some 350 million viewers in over 100 countries worldwide. Our Centers for Disease Control and Prevention experts gave the writers key messages about reducing stigma and about heterosexual transmission and risk. So this is a very short clip.
I have AIDS.
No, you are HIV positive.
I'm sick, Kristen.
What do you mean you're sick?
The doctor gave me a blood test that came back positive.
For what? Tony, what was the test for?
HIV. I'm HIV positive. Kristen, I love you. Yes, I want you to be my wife.
We got permission from the network to do a public service announcement featuring the lead character, Tony, giving the CDC's AIDS hotline number for viewers to call. Okay, so I'm going to explain this complicated graph. The PSA was aired first when Tony learned he was HIV positive on August 3rd, which is the red arrow, the lower red arrow. And the second time on August 13th, when he disclosed this information to his fiancée, Kristen, an extremely emotional plot point in the story. This resulted in the highest peak in callers all year, a total of 5,313 calls in a single day, higher than any of the other times this number was aired on TV during that year, during a 12-month period. The second highest was for National HIV Testing Day, which involved an enormous campaign with significantly more national support and media exposure. Now, compare that to 60 Minutes, the Surgeon General's campaign, and even MTV. They didn't come close to a minor storyline in The Bold and the Beautiful. So we use this type of tracking to show that TV viewers can be moved to seek more information about health topics when they're tied to a storyline with characters they relate to and when the PSA is aired at a dramatic plot point. So Hollywood Health and Society also works with the writers from the Fox series House. The diagnostic nature of the show allows for many opportunities for health topics to be introduced. So in honor of World TB Day, I'd like to show you a clip on the important subject of TB around the world. The clip is called TB or Not TB.
Dr. Sebastian.
2 pallets of antibiotics for tuberculosis.
We've got 6 pallets worth of patients.
So Tucker needs a math lesson. I'm headed back tomorrow.
Hey! Hey! Look at these! Taylor! Help you! Look at the bullshit! Come on! Come on! Keep let the truck through! Let it through! Move through! Let the truck through! Move those boxes quick, quick! Let's move! Hurry! Let's go, man! Hurry!
Help! Help! Dr. Sebastian! Come quickly! My son, he fell. He fell on this log. We are just waiting for his friends. Tahoma, nilikwambia usicheze huko.
I got no breath sounds on the left. Give me that. Yeah, he's gonna be okay. The fall didn't cause him to drop a lung. The lung caused him to fall. TB chewed it up. He'll be lucky to live another year. Well, this is Sarnie. I picked up the tab for the back brace myself. The funny thing is that the brace costs more than the medicine that would have prevented her from needing it. It's your medicine. All of the antibiotics that we need are right here in your warehouses, in your factories.
We provide over 10,000 doses a year.
Which is not enough.
You know we'd love to do more, but our hands are tied.
New car, Jerry? I saw it on the way in. Looks beautiful.
Don't make this personal.
All the way from Germany, too. I know that's a lot of red tape.
I'm not like you. I'm not ashamed of making a living.
And I know you didn't become a chem major for the money. Now, you want the same things that I want. You just have to push a little. You have to push a little bit harder. Harder for it.
Sebastian?
I don't know.
Call 911.
Okay.
Isn't someone here a doctor?
There's nothing there.
Yeah, there is.
It's all preventable. Stoya Tucker makes medications right here in New Jersey. They have warehouses full of the stuff. There's more than enough to go around. So if I can get them, why can't Lil? Why can't Quismo? Why can't Sarnie? Another person just died. Where is your outrage? No.
Okay. Yeah, it's a great clip. It's a great clip and an even greater message about the importance of making TB treatment accessible worldwide. Next, we'll hear from Sally Canfield, who will talk about her impressive work with the Bill and Melinda Gates Foundation, where she addresses global health issues such as TB, polio, malaria, and HIV and AIDS, among others. Sally, the floor is yours.
There we go. Thank you very much. I think a lot of what we've seen today underscores why the Bill and Melinda Gates Foundation supports projects like this. Storytelling is such an important component of how we discuss our lives, but it's also such an important component in the developing world. And what we found recently, much like any large organization with a head of an organization that's someone like Bill Gates, he recently turned to us and said, you know, I'm on the ground a lot and I see a lot of things going on. I see some positive stories. Can somebody pull that together for me? I'd like to start talking about it. And so, of course, for us, you know, that meant, oh my God, what are we going to do? And and we, you know, what does that mean? And we didn't know. And we thought that the information was out there. And what we found among our partners was that the data and the information we were using was about 20 years old. We had not even known what was going on the ground from the groundbreaking programs that we had recently started here in the U.S. and around the globe since 2004. And so what we started to do was really look into what did it mean to provide, to start the PEPFAR program, or the PMI program, or the Global Fund, or UNAIDS. And so what we found was that everybody had anecdotal evidence, but no one knew what was actually happening. And if you talk about not knowing what the negative stories are, we didn't even know what the positive stories were. We didn't know that, that polio is now 99% cured. We have 4 endemic countries left. That we have approximately 1.2 million lives have been saved over the last 5 years because of the PEPFAR program. That, bed nets are now a fairly common practice in developing countries. And so what we wanted to do was tell that story, and Bill and Melinda wanted to tell that story. So we started to compile this, and we wanted, I think the other point that was made tonight, which was incredibly important, is that all these numbers are overwhelming, but if you are able to boil it down to a single story about an individual in a village or in a country that is now is representative of what is happening throughout the country, people respond so much better. But even more importantly, and look, I'm here in DC, and in a city that everybody prides themselves on being knowledgeable about every topic at all times, we did some great focus groups with people that we felt would know what was going on. These are people that felt, said, I read 4 newspapers a day, I have all 3 cable shows on, I know everything that's happening. And we found they had absolutely no idea what was happening in global health. They had the exact same stereotypes of aid and foreign aid that you would see on late-night C-SPAN call-in shows. It goes down, aid goes down. Yeah, don't watch this, it's scary. Foreign aid goes into the pockets of dictators. Foreign aid is wasted. 50% of the U.S. budget goes to, supporting Egypt or whatever. I mean, it was completely skewed. And these are people that we thought, oh my goodness, we have so much work to do about telling people what is actually happening in the developing world, especially since these programs have just started. And so we came back with this information to Bill and Melinda, who just were stunned. They said, I cannot believe this is happening. We've made a lot of progress. So much more needs to be done, but we have made so much progress, and no one is telling this story. So the group of us convened back together, and we decided to call it the Living Proof Project. And if you go to www.livingproofproject.org, there is not only a number of small 3-minute videos, which of course we geared that toward the DC audience, of which has a time span of a flea. So 3 minutes was what we gave each video, but we sent former Nightline producers out into the field. We gave them our contacts and said, go find the stories. Go find what's out there. Tell us what's happening in the field. We came back with some fascinating and really, for all that's going on, and believe me, there is tons and tons of stories that could be told that are negative, and believe me, they should be told, but there's also a ton of stories that can be told that are positive. There's a story about a woman, and we call it Barbershop, and she's HIV positive. She got it from her husband. He wouldn't let her get tested. He eventually passed away, so she got tested and her whole family got tested. They're all positive, but they're also all getting ARVs from the PEPFAR program. And she started a barbershop in her village in Ethiopia. And if you watch the video, she asks everybody when they come in, have you been tested and what is your test result? And she goes through the whole storyline for herself and her family and what's happening. And believe me, after you get that haircut, I mean, you better go get tested or else she's going to find you. So I think that these are the kind of things that we need to talk about, because not only, I think in this environment here in DC today, where we have so much partisanship and we have so much negativity, the reality is that global health is probably one of the areas that we can all agree on. And that's been through the last administration and through this administration. I think that both parties really do feel that this is an important investment. And I think, just to put the investment in context, the federal budget for 2010 was roughly $3.5 trillion. Of that, only $8.6 billion, or approximately 1/4% goes to global health. So not only is there room to grow, by the way, for anybody in here who's responsible for the budget, but it's a small amount, and that small amount is having an enormous impact. I think the other piece too is that it matters that we have a constituency for global health. That was the other piece we found. We have no, there are so many organizations out there that have a constituency for their issue. And those people call their congressman, they call their senator, they let it be known that they are watching the budget or they want to see these investments made. Up until a few years ago, people in Africa didn't have they didn't have any organizations here in town that were willing to speak for them. Now we have, I think, a fairly vibrant advocacy community here in DC, but we have to get more active and we have to get better at telling members of Congress that there is a constituency out there that is watching this budget line, that they want to make sure that these investments are made and that they're not cut. I think in an environment today, it is so easy to say, well, these programs aren't working, typical, foreign aid, we'll just cut it here and everybody will be happy. Not really. I think that what we found now is that through PEPFAR, through the Global Fund, through the PMI programs, that these programs are working, and they're working well, and that they deserve to be funded and that they deserve to be grown. And I think that if you, if you go to the Living Proof Project, what we've done is really come up with a kit that people can take to their members of Congress. They're fact sheets like this that you can print off and that you can bring with you. I also encourage people to go to one.org. This is a partnership that was forged a long time ago between two unlikely people in the name of Bill Gates and Bono. And yeah, Bill's on Twitter now, by the way, in case anybody wants to follow him. But he has some interesting insights on things. But I think that one is really one of the most effective advocacy arms we have here in DC. And they have 2 million people on their service that they'll click through. And so to the extent that you can sign up, and those click-throughs, they make a difference. They make a difference to your member of Congress. They make a difference to your senator. I think the other thing, too, that we also have to recognize is that, again, we have to make our voice known because this is a really tough time for us. And so by telling the story, I think, in a positive way, by saying, thank you, members of Congress, you were way out ahead of the American people. If you talk to the American people about investments that were made in global health, not only does no one in DC know about it, then try to extrapolate that across the country. No one knows that what the U.S. has done. Bill Gates recently testified in DC last week, or it was the week before, but one of the things that he said in his testimony is that the investments that we've made in global health are some of the greatest investments that the U.S. has made since the Marshall Plan. We have saved an entire, there are so many people in Africa that have been saved by these programs, and we don't talk about it enough. We don't talk about what has happened and why, and make the case that these programs need to stay in place, they need to be extended, because they're working. And in a town where, not everything, there's a lot of programs out there that can say aren't working, these are working. And so I encourage you to sign up for one. I encourage you to go to our website. I encourage you to talk to your members of Congress and say, this is important to me as your constituent, because that's the only way that we are going to make sure that these programs stay in place. So I encourage you to do that. I thank Sandra and Hollywood Health and Society. I think that we've shown now why storytelling is so important and these components are so important, and that if we don't start to educate ourselves, our friends, our families, our neighbors, then these stories don't get told. And so I think to that extent, this is important. This is why we're so excited to be a partner with them. So thank you.
So my one quick follow-up question for Sally is, do people know what global health means?
Oh, that's a great question. No. To be really honest with you, no. And we did, in these focus groups that we did, not only in DC, but around the country, we asked what global health meant. The answers were as wide and as varied as you can imagine. People thought it meant that it had to do with all sorts of things that had nothing to do with HIV or malaria or TB or any of the issues we talk about. They thought global health meant something here in the U.S., they thought it meant global health, this is a new one, health tourism. Sort of, I was like, no, this is not about getting facelifts in India. So, which has been, when people come back and say this, this shows me that we have such an important part that we can play here in education of our, again, your members of Congress, your friends, your family, your neighbors. I think that it behooves us to go out there and talk about these issues in a way that I think, going back to the individual stories, how do you take one story and extrapolate that to mean, this one person in this village got the ARVs and that's replicated 2.5 million times across the Africa. And so I think that it's something that we have to continually, we assume that we know what it means because we talk about it all day long, but I will tell you, if you look at any of the data that we produced on the Living Proof Project, there's a long way to go.
Thank you. Well, now we'd like to take questions from all of you. So when you're called on, someone will give you a mic. Who would like? Yes.
I'm Margaret Miller. I'm with the Consultative Group to Assist the Poor, which is housed at the World Bank. And, I've seen some of these clips before, and they always really get to me, and it's obviously such a powerful medium for effecting change. Since you're already looking at some of these global issues, how do you see this kind of storytelling being able to be brought to developing countries so that these same kinds of tools could be benefiting behavior change in developing countries as well?
Well, it's being done a lot and Sandra can talk about it too. At USC, they're supporting and doing a lot of research on soap operas in South Africa that deal with HIV/AIDS and women's empowerment, both on the radio and on television, so that they're doing their own shows. Our shows are on in India. When I was in India, I was actually teaching writers. It's interesting, I was teaching writers about HIV/AIDS and how to incorporate it into their storylines because I had done it on ER with Gloria Rubin's character, Jeannie Boulet. Cut to, that was in 1994 to 98. Cut to the present, there are no HIV-positive lead characters on American television. There are in India, but not in the United States, even though HIV is still a profound problem, particularly amongst young gay men and African American women, in growing numbers. So why is it? So we have to tell that story. We can't just tell stories globally. We have to tell the stories about some of these global health issues in our own country. They're being neglected. So we're trying to do that here, and our shows are seen, and people ask me about iced tea when I go to South Africa, or they asked about Mariska when I go to India, but they're watching our show, so they get these stories, and there's some really interesting work that's been done recently about how American television changes women's lives in particular. So there's a writer for foreign policy named Charles Kenny who's written some really interesting pieces on this, that American television shows women that they can have jobs, that they can be educated. So there's a real positive element, beyond health, but just living, that these stories tell. But fortunately, there are new shows being done around the world in individual countries, in Afghanistan even right now. So that's where, there's a lot of possibilities. And I know that the work that is being done, Sandra, Latin America as well, is pretty interesting.
Margaret, thank you for that question. Well, as Neal said, we know that the reach of U.S. programs is worldwide. I spent a lot of time in the Middle East over the last 12 months, and showing clips and showing impact results and talking with people about our model, really bridging the creative community with public health. And people would come up to me afterwards. They know every show in the series of Law & Order SVU or in Grey's Anatomy. They know them better than I do. And so these shows are being watched. And I remember asking some women in Oman why they watched these shows. And they said, Sandra, this is the only way we can learn how justice is delivered or how healthcare is delivered. And they do watch the programs. But what Hollywood Health and Society is doing in partnership with the World Bank is we're going to set up a network of centers for entertainment education, like Hollywood Health and Society, but in the major media markets around the world that serve developing countries. So we're looking at India, Egypt, South Africa, and Brazil, and eventually Mexico and Nollywood, Nigeria. Because we know that there are many campaigns and there are many individual soap operas and programs around the world that have social content. But we don't know of any sustained and systematic models of outreach the way we have, which are actually very inexpensive, but to provide on an ongoing basis accurate content on development issues, whether it's health or conflict transformation or finance or the environment. And so that's the model we're moving to. And we envision having a network of centers with the hub in Hollywood, because every creative community in the world wants a connection to Hollywood, because Hollywood does it best or really well. So to set up partnerships with writers and others so that the network can kind of feed it, nurture itself and each other. So that's our plan.
New media, for instance, as I said earlier when I was speaking about the documentary and how we, and about the show and how we use Twitter, for instance, but new media has a huge and profound place for health storytelling. In India, for instance, where culturally it may be still somewhat a taboo to discuss sex education in the home, the Indian cell phone company has provided games, video games, where young people can go on for free and learn sex education. And so this is all happening, and if you go to a book called Design Revolution by Emily Pilliton, she shows 100 different design innovations, and that's one that are changing the world. So you can just imagine, as I said before, 1 out of 3 people have cell phones in Congo. Women use cell phones in Congo to inform each other where rapes are occurring. So mobile phones, really beyond laptops, because everybody doesn't have a laptop, and we don't have the satellite structure yet to connect everybody through laptops, but mobile phones, yes. So that's where we have to really start thinking, how can we do that? And then I could take a clip and embed it on a mobile phone, for instance. So there's a lot of very interesting work going on where storytelling can lead the way on mobile phones.
Sally.
I think also that the concept of new media really has to be taken also to the individual level. Someone once told us that no one should go to Africa or the developing world without a flip phone. So to the extent that you can have, we've been toying around with the idea of having a living proof channel on YouTube, so that anybody that wants to go and put up their own story can. That can go viral. I mean, I think what we've learned in the past now, several months, with respect to things that are happening around the globe, is that once that goes viral, it goes pretty fast. Yeah. And so to the extent that we can tell stories and that our partners can tell stories and people on the ground can tell stories, and that can be uploaded via camera phone or what have you, I think that there's a lot of opportunities there that we have to be willing to take a gamble on.
Who's next? Yes.
Hi, my name's Riley. I recently started at Georgetown School of Foreign Service, and I'm studying media and politics. And I was wondering what you think could be done specifically in Hollywood for executives and writers and actors and actresses to sort of convince them to incorporate these global issues of health and development in maybe like younger shows like Gossip Girl that have a hugely young audience.
Well, that's actually our job at Hollywood Health and Society. So, yeah, that's what we're trying to do. That's what we're working on. So what we've been doing is holding panel discussions at the Writers Guild of America West. We have a partnership with the Guild. The president is actually the co-chair of our advisory board with Neal. And we bring in experts on global health, and we bring in people who can tell real stories, so that they're real stories of real people and case studies, and this is what inspires writers. If you want content in TV storylines for any age group, you've got to work with the writers. You know, people often think of celebrities, and Mariska is unique, but it's really the writers behind the stories who are creating this kind of content and have the power to put global health into a storyline. So that's our primary audience. It hasn't been that easy. I think from my experience with writers, writers tend to write about things they know, they've experienced, they care about. So you've got to really inspire them, and to get someone to really understand what it's like in a developing country when they haven't been to a developing country is a challenge. So we are actually working to set up, we've got some other things. I don't think I'll talk about them right now because they're not, the deals aren't quite closed, but we have some very exciting new ways of giving, let's say, writers direct experience of developing countries. Read between the lines.
Yeah.
Okay.
Yeah, I think that that's, I mean, one of the things that we hope you do, I think firsthand experience is incredibly important. We found that through members of Congress here, through people that are policymakers who were skeptical, that didn't know what was happening, or just it wasn't on their radar screen. Taking them to the location, taking them to clinics, taking them to places of conflict, I think is a profound experience, and it changes you forever. I can't tell you how many people that we've taken on a trip, or that I've gone on a trip with that came back and said, what can I do? It's probably the singularly best way to invest money in terms of trying to change people's minds.
Thank you. You're next. Could we have a microphone up here, please? Thank you.
Good evening. I'm a pediatrician, okay, past president of the American Academy of Pediatrics, and one of the stories that I think needs to be told, and maybe it already has begun, is about vaccine preventable diseases. I think the difference in what's happening in the U.S. versus what's happening in the global community is just unbearable for someone who knows about these diseases. We are getting so many vaccine refusals, people who have never seen these diseases, where when you go overseas, you know that about 250,000 children over abroad die from measles, for example, from the complications of measles. And so this sort of contrast in terms of people refusing help versus what's happening in the global community, where we need to get more vaccines to children, is certainly something I hope you can think about how to work into a story if it hasn't already been done.
We did it last year, right, with Hillary Duff. We did a story about, we like to ask questions that are the basis of our show. So we asked the question, what is a parent's social responsibility to vaccinate? We know that a lot of parents have various points of view about vaccinating their own kids. But what happens when you don't vaccinate your child and your child comes down with measles? And in fact, Mariska's husband, Peter, who's an actor, was the lawyer in that episode with Hillary Duff. What happens when your child exposes another child who, in this case, was a 10-month-old who can't be vaccinated? She was too young, and that child dies from measles. And we had data about the last measles epidemic in the United States, where 123 kids died between 1989 and 1992 or 3. So we just put it out there for people to talk about, because they have very strong issues, or strong beliefs in the United States. But it's also, you know, we haven't done it on an international basis. But I imagine we could, because people come in with various, you know, if someone came in with polio, say, into the United States. But the good thing, as I said about our show, is that it's repeated a lot. So I bet if you over and over on USA. So I bet if you.
Oh, they know.
So if you went on YouTube, and you went SVU and Hillary Duff, and we purposely cast Hillary Duff. I mean, that's like the little, you know, I figured, how do I get like young people to watch this episode? Well, I'll cast a young icon. And so it got a lot of attention. People didn't agree, but they, you know, as everyone has said, they talked about it. And they talked about, gosh, what is my responsibility? I know what I feel about my own kid, but it broadens the thinking a little bit, and it's tough. So we have done it, but it certainly can be done by many, many shows.
And on an international basis.
Right.
We like that idea.
I think one point here, vaccines is actually, the vaccinations are the cheapest way to save a life in the developing world. Bill and Melinda just recently announced at Davos a $10 billion commitment over 10 years to vaccine development and distribution. It is one of the most important things that we can do. And they wanted to have this next 10 years be the decade of vaccines. And I think that we really have to take this seriously. It is absolutely one of the most inexpensive ways that we can save lives.
Okay. So this woman here and then.
My name is Umra, and I have a question as to addressing the harm side of some of these initiatives as far as the psychology of the people is concerned, where you have this media that's bringing all these external ideas, and it's always about teaching and bringing something, and never about how you extract something from some of these even indigenous communities. So let's say, for example, something like addressing the obesity situation in America. What can you learn from these communities that you're always putting something upon? I don't know if that makes sense.
It makes a lot of sense. And one of the things this reminds me of is we look at the social determinants of health disparities. So we're looking at communities and looking at the way space and place or the environment impact health. For example, and we're funded by the California Endowment, and this is their main focus. We can talk to mothers from now until we're blue in the face about feeding their children healthy foods, having the kids go outside to walk and exercise. If that family lives in an inner city where they don't have access to fresh vegetables or fruits, there are no sidewalks and there are no parks, and it's unsafe for the kids to be out, we're not really getting at what's happening in that community. And so we look at the environment. And to do that, we have to understand, from the inside out, the reality of people day to day. But it gets back to storytelling. We need to have the stories of those people. And in fact, we do. Because of our work, the California Endowment started a story bank. And they went into communities and they started having people tell their stories. And they bring the stories to us at Hollywood Health and Society. And then we set up briefings with writers and producers like Neal, and we take these community stories to them to see if we can inspire them to turn it into a TV storyline. So that's one way we're doing it.
And I met the California Endowment people through Hollywood Health and Society, and so I took my project that I've done in Africa with Venice Arts, and they do it in LA as well. And now California Endowment has 14 cities. They're really focusing on putting all their money into helping communities identify the issues that are affecting them and how to design ways to do something about it. So we gave cameras to kids in Compton, which is in South Central LA, so that they could tell stories about what concerns them, and they could share their photographs with community centers, or at community centers, where they're discussing these issues with adults. And so now we're moving into 7 other cities with the hopes that we'll go into all of them. But these kids are telling their own stories, what affects them, what they're thinking about. And what's interesting is once you have a camera and you have to really look, and you're learning about telling stories, and you're not just, we just don't give kids cameras and say, hey, go out and shoot pictures, but we really talk about stories, we show them examples. Once you have a camera, it kind of gives you a way to look at the world, to really focus, as Alcides said, or I think he says in the whole, not in the clips, but in the film, he says, when I got my camera, I started to see my city, Maputo, in a new way. So we give kids cameras and they can start to see the world in a new way, in a fresh way, start taking pictures, and then they can articulate what worries them or what things they like about their community.
This gentleman here, and then this gentleman in the back. Yeah. Okay.
Hello, my name is Bob Enholm. I'm with an organization, a nonprofit organization called Citizens for Global Solutions. And the work you're doing is really wonderful. When you talk about storytelling, you're really not telling all of the story, because part of it is also values. Storytelling is the foundation is the values, and you're illuminating the values. What occurs to me, I'm a lawyer and I work on a wide range of issues, and what occurs to me is that these health issues really are not only health issues. They're issues relating to children, issues relating to women, issues relating to justice. And so I guess I would like to encourage each of you to think broadly about the values the world has, and there are some values we all share as human beings that America may need to learn a little about. I mean, I think sometimes we think we lead the world in everything, and in fact, like the UN Convention on the Rights of the Child, the United States is one of the only countries in the world that hasn't adopted. Unbelievable. The UN Convention on the Rights of Women, the UN Convention, the International Criminal Court, all of these are international initiatives that could be illuminated and about which, frankly, Americans would benefit from learning a little more, and about which I think the whole world would benefit from knowing about our shared values, not just health, but justice and humanity. So thanks very much. Yeah.
Okay. We have one more in the back.
Hi, my name is Mike Drashkovich, and I have to thank Sally. I work at the One Campaign, so thank you. And to return the favor, I have to say I've seen the Living Proof Project, and it's one of the most compelling pieces of educational material, and it will really move you. So I do hope that does get around to everyone here. Before I get to my question, I also want to address Mariska and your project. Thank you for sharing that with us, and I hope you know that there's a movement now going on in issues of maternal and child health, and that how these same women who are victims of rape are the future and hope for a lot of these developing countries. And so all you have to do is Google maternal and child health, and you'll see the amazing progress in this area, and I think it links very nicely to what you're doing. But 2 weeks ago, I attended the testimony that you spoke of with Bill Gates and Bill Clinton, and I thought it was almost a watershed moment when to hear Bill Gates say that it is important, it's not only important, it's necessary that we have creative voices and storytelling people in this process to make aid more effective. And I thought this is so exciting, because I come from not only international development background, but also entertainment, so I see the value what you guys are doing to communicate this to other people. Can you talk a bit about the overall vision, the big picture, and where you see this movement and what you're doing, the work you're doing right now, where do you see that in 10 years? Like, what do you eventually want this to become?
Well, I think one of the things that, and thanks for the question, and thanks for the One Campaign's support of what we're doing. This was really a test drive for us. We wanted to see if people were interested in what Bill and Melinda were talking about, because heretofore they really hadn't been. People knew what the Gates Foundation was, they knew who Bill Gates was, but they weren't quite sure what we did as an organization. And so Bill and Melinda came here to DC and gave a speech called Why We Are Impatient Optimists. And they really are. They are optimistic people about what they see in the future. They hope that the resources that they're dedicating to vaccines and to research and development, I think, Bill is the ultimate optimist in that he refuses to give up on the notion that we are going to get an HIV vaccine. He knows that it is scientifically the most challenging thing we will take on, but he refuses to believe that we don't have the minds to be able to come up with it. So we hope that through the Impatient Optimist speech, which interestingly enough at Davos, where they made the announcement of the decade of vaccines, almost every world leader in the developed world, so all the G8 leaders, asked Bill to come to their countries to give the same speech. And so my hope is that through our own advocacy and through the use of Bill and Melinda's voice and the resources that we have at the foundation, that not only can we invest in advancements so there are permanent solutions to some of these global health issues, but that we have been able to educate not just those people in the capitals, policymakers that make the decisions, but also those people around the policymakers that help them make those decisions, and that the public in those areas. And I think that what we found is that there was an initial spurt in the last several years around these issues, around especially HIV and malaria. But I will be very candid with you when I come and talk to some people here in the Capitol, that they're like, yeah, we're not really, that's kind of last year. And I mean, it's fascinating to me. I get told that there is a, quote, treatment mortgage now for people that are on ARVs. That we have spent, that we can't spend any more money because we've put too many people on treatment, and so now we have to stop because there is a, quote, long-term treatment mortgage. And I really hesitate to have policymakers tell us that people are now treated as a financial transaction. And so I think we have to really, what we hope that Bill and Melinda can do is really start to educate people about why this is necessary, why for the long-term health and development of the planet, that having a healthy society and a healthy, productive people in their home countries are going to benefit us for the long term. So over the next 10, in the next 10 years, I hope this becomes something that people talk about regularly. I hope it's something that they say, yes, it was a worthwhile investment by my government, regardless of whether I'm in France, it was fascinating. Bill went to see the president of Italy, and the prime minister, and they hosted the G8 last year, and they were just sort of dismissive about the commitments that they had made to this agenda. And I think we have to hold them accountable. The Canadians host the G8 this year. Let's hold them accountable. Next year it's France. Let's hold them accountable. They've made commitments, they've made promises, and so I think what we have to do is make sure that we are using our own collective voices through both people that have a worldwide stage and ourselves, that we hold countries accountable for the kind of commitments that they've made to these issues.
Thank you, Sally. Well, that was our last question for tonight. So I want to call your attention to the evaluation card in your information packets. They're very small, and it's just a few questions, and there is a drop box by the back door. And it will help us plan our future events if you'll fill them out. We really appreciate it. So I'd like to thank you all for coming for what has been a wonderful, inspiring evening. And I want to extend a warm thank you to all of tonight's speakers. We've all made so much progress towards improving health and well-being worldwide. And with the ongoing help of Capitol Hill, Hollywood, and young filmmakers like Alcides Suarez and others, we can unite the world in reaching our global health goals. It is possible, and we can do it. So thank you all for being here tonight.